The stroke happened in March of 2021. I'm the mother of 8 and grandmother of 17. I'm used to cooking big meals and sharing food with my family. Those are things that I have been used to doing. I started feeling strange in my head. It really wasn't hurting. I just felt different. I didn't feel like myself. My daughter took me to the ER and they began to examine me. After they checked my vitals and I was in the ER for a matter of a few hours, they had different doctors and nurses coming in. I was admitted for a suspected stroke. The stroke affected the right side of my brain, and it affected the left side of my body. After that, I began to have therapy, physical therapy, PT, OT, and speech. Since the stroke, I'm able to go into my kitchen. I can cook. The double vision has gone. I still have distorted vision, and my balance is still affected. I still can't drive yet, but I refuse to give up. I refuse to give in. I am constantly hopeful daily because as I look at my life, I haven't gone backwards. I've steadily gone forward. As I stated, it hasn't been the speed that I would have liked, but it's been constant.
My stroke occurred April 22nd, 2021. I was a corporate trainer for years, and I wrote a lot of the landscape when it comes to internet and the digital transmission of things through fiber optic and things like that. I was actually on a plane coming from Colorado, and I was so tired I basically fell into bed. I thought I was getting COVID or got sick because my body felt very heavy. So I hopped in the car, was headed to a hospital that was 10 or 12 minutes away. About halfway there, I forgot how to get there. The thing that I really can remember was that I had a blood clot on the left side of my brain, which was the thing that basically, I guess, created the stroke. It took about a month after, but we started with speech therapy. And, you know, things have really, as you can hear, I've done a lot better now. And I've been working with Dr. Bonner. For me, I think a lot of it had to do with stress. And I had to learn that life is stressful, you know. I had to get better at managing the stress, right? So I'm a little better at saying no sometimes and understanding that I don't have to take care of everyone, right? Taking care of me is important, you know. I'd always been able to fix everything in my life. I was that person, and I couldn't do this.
It happened January 12th, 2022. Before my stroke, I was independent. I also worked full-time, and I was a busybody, which means I'm always up and moving around and doing things. I attempted to get out of bed and I lost my balance, and I used my call voice on the phone to have my son come over because I wasn't able to get myself off the floor. He called 911. They immediately came and took me to the nearest hospital. Roughly about 24 hours later, I was sent to another hospital, and that's when they discovered that I had the stroke. My stroke affected the left side of my body, which I'm unable to use my left hand at this time, and I also walk with an assistive device because I'm unable to walk normal. The type of rehab I had to have was physical therapy, speech, occupational therapy. My stroke was caused from a blood clot. It traveled to my brain, and I was diagnosed with an ischemic stroke. Monitor your blood pressure, cholesterol, and reduce your stress level.
(2021). I used to be a nurse. I felt dizzy and lightheaded, a bad headache. I couldn't move my arms and my balance was off. I told someone I believe I was having a stroke. The person that was with me, I told them. We went to the emergency room, and the doctor evaluated me and took an MRI and told me I had a stroke. I said I had diabetes and high blood pressure. And I couldn't do my work anymore. I had to quit work. I had to go to inpatient rehab, have physical therapy, and occupational therapy, and speech therapists. What I'm doing now, I still got to go outpatient physical therapy, and occupational therapist, and speech therapist. I had to go 3 days a week. It's called day rehab. They wanted me to continue with therapy. Know the signs and symptoms of the stroke, know your risk factor, and take it seriously. Make sure when you have these signs and symptoms that you go immediately to the emergency room. I wasn't serious about my signs and symptoms, and I should have been more serious about it. And I should have went right away to the emergency room. Yes, that's what I want to tell them.
I'm a speech-language pathologist, and so I've worked with many people who've had brain injuries just in general. So people who've had stroke, people who have had traumatic brain injury, people with Parkinson's disease. So I've worked in the area of neurogenics for quite a while, and so people who've had some sort of disruption to the brain, you know, they've always been of interest to me. I was inspired to work on this campaign to increase prevention and awareness of stroke, in part because most people don't know what a stroke is, and not only do they not know what a stroke is, but they certainly don't know that the consequences of having a stroke can really be devastating. But not everyone who has a stroke has an unhealthy lifestyle. However, it does help to minimize your risk of stroke, to eat healthy, to go to the doctor, to exercise, and to do all the things that we know that create a healthy lifestyle. It may not completely prevent you from having a stroke, but it can certainly help you. I wanted to develop an initiative where I could help to educate people really prior to someone having a stroke. So that was really why I developed this campaign, because I thought the best way to try and get younger and older people aware is by developing some sort of creative media campaign. And so that was really the reason for this.